sit with you all, hear your stories, hear what you're building, hear some of your wisdom, and share that with this group here. So let's start with a round of introductions. Tell us who you are, tell us about your company, tell us your company, and give us under a minute about your health moonshot. What's your vision for your company? Let's start with Jakob.
Sure.
Go down.
Thanks for having me. So Jakob, CEO and co-founder of Joint Academy. So Joint Academy connects patients with licensed physical therapists to deliver online treatments for chronic joint pain. And kind of our moonshot is around, we want to become the global standard treatment for chronic joint pain. So it's a lot about how you treat chronic diseases in a much more efficient manner, and it's a lot about accessibility. So yeah.
Okay. Colby?
Great, thanks for having me. Colby Takeda, co-founder and CEO of Pear Suite. We have built a SaaS platform to address healthy aging for older adults, specifically around the social drivers of health. And about 90% of healthcare costs right now are all around those things that really don't matter, right? Things like medications, treatment. We know that only drives about 10% of health outcomes. The other things is the physical environment, social and economic behaviors, as well as healthy behaviors. So if we can address those, we can better assess and address the drivers of health and improve independence, healthy outcomes, and increase engagement for older adults.
Okay, we'll dig into a little bit more about how you're doing both those things, but Rachel, go ahead.
Thanks so much. So my name is Rachel Trobman. I'm the CEO and co-founder of Upside Health, where we're transforming the way that chronic pain is assessed and treated. We primarily do that through our platform Branch, which is creating a better, more robust, more dynamic, and more accurate pain score, and then delivering the elements of care that clinicians are often undertrained, undercompensated, and don't have time for, which is the biopsychosocial part of chronic pain.
Awesome. Okay, Michael?
Great. Yeah, thanks, Logan. I'm Mike Havig. I'm the founder and CEO of HealthMe Technology. We're a digital marketplace for healthcare that allows patients to shop for their care like they shop for everything else, using quality, convenience, and price. And the reason they can't do that now to some degree is doctors don't know how to retail their services. And I know that this is a physician. And bottom line is we teach them how to retail by giving them a 24/7, 365 marketplace page on their website. So we're kind of like a Shopify for healthcare, if you will.
And I'm Logan Plaster. I'm the media director at StartUpHealth. We have limited time here today to dig into each of these solutions. We'll do our best, but something that we really care about at StartUpHealth is telling the stories of health moonshot progress throughout the journey of a startup. So you can read more about any of these companies or any of the rest of the companies that we have supported at StartUpHealth.com, through our podcast, our YouTube channel, through our print magazine that you may have gotten in your attendee bag, et cetera. So I encourage you, if you want more information, to check out Startup Health Media. There's a lot more stories to tell. So I wanted to direct my first question to Jakob and Colby. Something that kind of inspired me listening to your stories earlier and reading about what you've done is this idea that sometimes the best health innovation involves peeling back the complexity versus throwing more technology at a problem. And I see that in both of your solutions. And so maybe you could take that lens and sort of explain how sometimes less is more, and sometimes it's not really about the technology, about how you apply things that we know work already. So Jakob, why don't you start?
Yeah, sure. No, I agree with that notion. I think the healthcare system has a tendency to do a lot of unnecessary procedures like cool surgeries, a lot of medications, and a lot of gimmicks and stuff like that. And I think we're kind of on the spectrum to make things very simple. We have a very simple but yet very powerful application for our patients, but also for our physical therapists. And it's much more focused on behavioral change, exercises, patient education, peer support, and really showing how strong efficacy that actually has. So we actually published 12 clinical studies showing a lot of very strong clinical outcomes, just having this very simple, accessible, and affordable solution. So I definitely agree that I don't necessarily think that you need to do too many complicated things when it comes to the healthcare system.
Just to make it concrete for Joint Academy, we were discussing earlier about the options for someone with osteoarthritis and the idea of being presented with the option of surgery versus this modality that you've developed through physical therapy. So kind of paint me a picture of just the pretty broad difference there that's represented and efficacy that you can find.
Yeah, no, exactly. So usually when you get the diagnosis of osteoarthritis, you end up at elective surgery way too quickly, right? You see an orthopedic surgeon and then you go down that path where you get your total joint replacement. So we want to kind of intermediate that care pathway, and we want to connect the patient with a licensed physical therapist through our application instead, and then give them access to the right type of exercise, physical therapy, patient education, and those things. And in terms of clinical papers that we published, after 6 months in our treatment, around 40 to 45% changed their mind of having a total joint replacement. And to put that in perspective, that's like a $35,000 procedure here in the US. So yeah, that's quite steep. So there's a lot of important things to do to the better here.
Now, I had planned on this, but I have to pause because Mike is a orthopedic surgeon.
Sorry.
So actually, Mike, I'd love to
Yeah.
know if you have any thoughts on sort of sometimes the answer is less surgery.
Oh yeah, no, I'll just give a little statistic on orthopedics. So even though we're surgeons, about 10% of the people we actually see and treat in our office have surgery. In my practice, it's slightly less than that. I think we're like about 8. Whoops, sorry. And the long and short is, there's definitely, we start with non-operative care, and a lot of times that includes physical therapy, anti-inflammatory medicines, rest ice, activity modifications. So I'm in full agreement that the care starts non-surgical, and I honestly don't know any patient that would sign up for a knee replacement if they could avoid it. So I applaud what you're doing. I think it makes a lot of sense.
And I'm also, to my defense, I'm a son of an orthopedic surgeon. So
You understand? All right, Colby. So what are your thoughts about sometimes innovation involves sort of peeling back the complexity and opening up access by simplifying things?
Yeah, actually, one of our themes that we always tell is people that we want to simplify social drivers of health. It's very complex. People don't understand what's happening with older adults, the strengths, challenges, and opportunities for them. And then we also don't have the workforce to deal with them. The highest risk patients are getting social workers and case managers, but everyone should get the care around the social drivers of health. And so we can simplify it with actionable dashboards, our AI analytical smart scripting, as well as actionable next steps like goals. We can actually help them address some of the things like food access, social engagement, transportation, technology use. And so we actually use community health workers, people that are from the community that live and talk and breathe these things all the time, knowing the resources in the community to connect them with older adults to help them get access to these resources. We can really improve independence and get them better care.
Okay. What are some concrete ways that you bring in those community workers and you kind of get a full spectrum of care around a patient?
Yeah, absolutely. So we have this smart scripting dashboards that we actually create based on interactions by text and phone. So a very simple way we communicate with our older adults. We just use phone systems and text messaging to gather great data about their strengths, challenges, and opportunities. We use that to then lead to next steps. How do we help them get better access to food? How do we get them more connected to the internet so they can do telehealth visits? How do we connect them to people and groups around them to have purpose and start volunteering and be more fulfilled in their lifestyle? And so those are simple ways that we can improve their lifestyles, and these are the things that actually affects health outcomes versus traditional health services like medication, therapy, long-term care.
Interesting. Something that really stuck out to me when I was thinking about Rachel and Mike, your stories, is the power of our lived experience in sort of guiding a startup as it's growing. And I know that both of you have that. You really. You were maybe not. You weren't patient zero, but you were the first person to understand and then to grow from that idea, just from your own life. And we were discussing earlier, it's not everything to have a personal experience, and yet is a key component to how you build, and it drives you forward. So Rachel, maybe you could start. What is the power of having that lived experience? How does that look with Upside Health? And maybe also where are some of the limitations to that?
Yeah, thank you, Logan. I think that you really well spoke about what we have discussed, which is a personal experience is incredibly important when building the best product. And it also is incredibly important in building a product that you can stick with. Because with the long sales cycles, the complicated environments, having a core mission has been really, I think, important for us in having the longevity that we've had and being able to shoulder ups and downs. I started the business because my mom, who's here, has lupus, and so I grew up with a mom who has lupus and a brother who has cystic fibrosis. And so when I was diagnosed with a connective tissue disease, I was at a unique, albeit kind of unfortunate, advantage in that I knew how to navigate complex health systems and complicated health conditions, and yet still found an enormous blank space when it came to chronic pain care. Because it's so subjective and so complicated. And so for those reasons, I built this product. But it wasn't, our early products and even my personal experience was nothing compared to having the product out in the real world. So while the personal experience definitely was a great genesis, the amount that we've learned since our product launch is probably 10 times that, for seeing where our own experience had shortcomings, where our own experience was limited. And so I think that there's value in both spaces.
Yeah, that's really interesting. Important wisdom to know that that is a very essential piece of the foundation, and yet there's this journey that goes beyond your lived experience.
Yeah.
Definitely.
Mike, I know you had a frustration in your own practice that led you to investigate a problem and then build a company directly out of it. So how'd that look for you?
Yeah, well, a lot of frustrations, I think, with the practice of medicine, and particularly surrounding the billing and payment side of things, right? I think we can all agree, like in a perfect world, you'd know the cost of your healthcare in advance. You could pay for it in a simple fashion. You could actually shop for that care like you do everything else in your life. And what dawned on me, being a practitioner, is if you ask any doctor, if they take cash, everyone will say yes. If you ask their practice management team if they take cash, again, they'll all say yes. If you call their office and tell them you're out and at work or you don't have insurance or whatever, you just want to see the doctor and pay cash, you'll be turned away. And so only about 8% of physicians, at least in the orthopedic space, will take cash. And the reason is they don't want to take cash, they don't want to obfuscate their pricing, but they simply don't know how to retail their services. And I learned this because I practice in my hometown, so a lot of my high school friends are small business owners. So they're contractors, they own restaurants, they made the decision to pay as they go, or they have really high deductibles. And they would text me or call me at night fairly angrily saying, Mike, I tried to make an appointment at your office for my son. They wouldn't make me an appointment. And I'd always say, I get it, I'm booked out, we'll get you in. And they'd say, no, that's not it at all, Mike. It's because I don't have insurance, and I made it clear I'm willing to pay cash. And so that's the only reason I found out. I didn't know we were turning this away. And when we looked deeper, we saw that both my practice and others around the country, studies have shown this, we don't know how to bundle and price our services. We don't know how to retail our services. So what we've done is, starting in the musculoskeletal space, built close to 300 bundles that cover the entire continuum of care, from office visits to physical therapy to surgeries if needed. And we package those up in a nice little format like a Shopify does for a small retailer. So patients can go on that practice's website and buy the services they need. And it's actually been very, very enlightening for me. I'd say the downside of living the journey is we tend to get focused on our own problem, and there's other problems out there. And as we deploy the solution to a number of other practices, we see things that we didn't realize, right? That these people have similar but different problems. But the great thing is then we can modify the platform to accommodate them. So tunnel vision is, I'd say, the problem with having lived the solution or lived the problem to some degree.
Mike, your solution really inspires me with hope that maybe we're entering into a phase of greater transparency, whether it's pricing transparency or data transparency. And just a quick flip it back to the group. Do you feel like with your solutions, like that is a trend that you're stepping into, that transparency is a key to what you're delivering? Anybody?
I think in terms of, if we're looking at pain score, right, pain has been such a personal experience. And being able to look at the different facets that a patient experiences in determining what's impacting their pain, and then just making this data available not just for the clinician or the health system that's the pain specialist, but actually broadening it to the primary care doctor, who can now suddenly be able to recognize, treat, and support these patients. And then also for the patients themselves to be able to visualize their progress, their challenges, all of these assessments, less from in our perspective, a cost, but more from a visibility and a change mechanism.
Sure.
Yeah, similarly, it's all about how do we get more information to the client, patient, and to get better decision making on their end, right? So similarly, we also collect great data from the patient or the member, and they give us their risk scores or their assessment of how they're living their life, their challenges, their strengths. We always share that back with them, and we always ask their interests. So if we can get them their interest score and their individual strength score, we can actually help them with next steps. And we also think about transparency around resources, right? Helping them understand what resources are available to them in their nearby community, what services they may qualify for, and what they're not taking advantage of so they can have that best information, make good decisions.
Nice. All right, final lightning round question. I want to know what your next health moonshot move is. What are you most excited about for the next year for your company? Jakob, we'll take it down.
I mean, we're breaking a lot of new ground here in the US and in the European markets. We're talking maybe like 140 million people that suffers from chronic joint pain and MSK-related issues. So that's that's a huge problem to address. So I think just continuing building out our footprint here in the US. We partner up with some of the really big payers here, so we're going to continue to strive to do that. And then in Europe, it's a lot about public health systems. It's more like a Medicare for all. It's often publicly subsidized versus being private. So I would say just, expanding to more markets and treating more patients.
Awesome. Colby?
Yeah, Pear Suite's fairly new. We just launched last year. We just recently hit our 10,000th member that we helped in the community, so older adults pretty expanding pretty rapidly. Thanks, yeah. We're also geographically expanding, so we look forward to integrating more in other payer provider spaces in different states. We're also looking at how do we engage more older adults in their own care. So they actually are part of our care navigation team. So we actually have about 50 trained navigators right now that we're training internally, but we also help other organizations train their own staff. And so we're looking forward to doing more partnerships with different groups and providers, and also going to the community health space. So how do we work with more churches, more community groups, more senior centers to do this work that's really important.
Awesome. Rachel?
So at Upside Health, we are going to release Branch 3.0, which is the latest version of our product for clinicians to distribute to their patients. We've added on, besides our heart rate variance monitor, we've added a medication tracker. We're looking at a sleep mat, so getting even more passive insights on patient experience. We will hopefully top 50,000 patients this year, and then as we're doing so, we're looking at strategic partnerships beyond our traditional regional health systems and physician groups, but really in terms of other broad spectrum platform products that really haven't been able to serve the chronic pain community, which, while niche, is actually humongous. So being able to partner with other digital health providers, other software creators to serve this special population.
All right, Mike?
Yeah, well, I think one of the common themes we've heard on the panel here is partnerships, right? And so as we grow our network, we hope to have over 2,000 providers on the network by the end of this year that are geographically distributed throughout the country. And once we have that network, we can deploy it in a lot of interesting ways, right? As we're doing now in the Shopify experience for the practices. But I'm really excited about this meeting, and we need to talk afterwards about your PT thing. Yeah. Is at some point at the end of there's a digital experience that can go so far, and I firmly believe that digital first healthcare is where we're going, whether it's in the musculoskeletal space or primary care or anything. But at some point, we can solve a lot of problems that way. At some point, people need some brick and mortar care. What I'm really doing is building a network of transparently priced bundled care that's easy to understand and access for maybe a company like yours when they reach the digital end and need to see somebody in person, or the Hinges, the Swords, the Kayas, name the digital first company, the Amazon Cares of the world. So I'm really excited about being able to maybe work on some partnerships with some of these folks.
Awesome, good. I appreciate that, guys. Let's give them a round of applause. All right, hey, appreciate you guys being here.
Thanks a lot.
If you want to connect with Joint Academy, Pear Suite, Upside Health, or HealthMe, you can do that here down in our pavilion or read more about it at StartUpHealth.com. So thanks a lot. All right, guys.
Yeah, thanks a lot.
All right, appreciate it.